Social determinants of health, the role of pharmacists. Social determinants of health include factors like socioeconomic status, education, neighborhood, physical environment, employment, social networks, and access to healthcare. The belief is that these factors are huge contributors to the individual patient's healthcare outcomes. Efforts are being made within healthcare systems and on the government level to address and resolve this issue. Social determinants of health in relation to pharmacists. Information such as patient's zip code may be able to predict the likelihood of being a medication adherent and successfully reaching goals of therapy. Health systems must adapt to incorporate addressing a patient's social and economic barriers in their care plans. While it is clear that every healthcare provider should be aware of social determinants while serving patients, the question is, how involved should care providers, such as pharmacists, be actively involved in this matter? A study looked at views of different healthcare professionals about screening for social determinants of health while interacting with their patients. The study included physicians in various specialties, nurses, case managers, social workers, and pharmacists. The study took place at Kaiser Permanente Southern California, KPSC, a large integrated health system. The general consensus among the healthcare providers who participated were as follows. Social needs were common among majority of patients. Logistical barriers to addressing those social needs while interacting with patients included time and resource constraints. And finally, special programs should be created to address social needs for the patients. Here are a few arguments against pharmacists being actively involved in addressing and resolving social determinants of health. The training to become a pharmacist is more geared towards clinical application of knowledge. Pharmacists do not undergo sufficient training to successfully address and resolve issues such as housing, food, and insurance matters. Scope of pharmacy practice is focused on health or medication related issues faced by patients. The fast paced nature of some pharmacy settings, such as retail pharmacies, make it difficult to successfully address complicated social and economic matters that patients may present with. Expecting pharmacists to have a major contribution to resolving non clinical matters may jeopardize their focus on ensuring correct medication therapy, as well as adding onto a already heavy workload. There are other professionals such as social workers and community health workers who are appropriately trained and have knowledge of proper resources to help identify social determinants of health as well as successfully resolve those non medical barriers. Therefore, while pharmacists should be aware that social determinants are obstacles for their patients, they should refer patients to appropriate professionals instead of addressing those issues themselves.